Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. S2, hard sound. So the S2, it occurs during isovolumetric. So S1 is isovolumetric contraction, S2 is going to be isovolumetric relaxation. So the S1 was associated with the closure of the tricuspid and mitral valve. So the S2 is associated with the aortic and the pulmonological valve closure. Pulmonological valve closure. So what are the characteristics? So there is sounds like the word dub from the phrase lub dub. So it is produced during the beginning of the diastole and there is a loudest at the left upper sternal bottom. Then it lasts between 0.10 and the 0.14 seconds and it is brief, it is harsh and it is very high pitched.